Mpox is a serious public health concern that has recently garnered global attention. The virus, once confined primarily to Central and East Africa, has spread across the globe, causing outbreaks in multiple countries. Understanding the origins of Mpox, its causes, and its impact is crucial in our fight against this infectious disease. Previously known as monkeypox, Mpox is caused by a virus belonging to the orthopox virus genus. The name was changed to reduce stigma and more accurately reflect the virus's broader geographic distribution. The virus exists in two distinct clades, or genetic lineages. Clade 1 is primarily found in Central and East Africa, while Clade 2, specifically the IIB sublineage, was responsible for the widespread outbreak in 2022 and 2023. The origins of Mpox can be traced back to animals, with small mammals suspected to be the natural reservoir, although the exact source remains unknown. The first human case was identified in 1970 in the Democratic Republic of Congo, and since then, sporadic outbreaks have been reported in several Central and West African countries. However, the 2022 outbreak marked a significant shift, with rapid global transmission, primarily through human-to-human contact. The emergence of Mpox as a global health threat underscores the interconnectedness of human and animal health and the potential for diseases to transcend geographical boundaries. It serves as a stark reminder of the importance of global health security and the need for robust surveillance systems, rapid response mechanisms, and international collaboration to effectively combat emerging infectious diseases. Understanding how Mpox spreads is crucial for effective prevention and control. The virus is primarily transmitted through close contact with an infected person or animal, or with contaminated materials. This close contact can include skin-to-skin contact, face-to-face interactions, or contact with bodily fluids. Direct contact with the characteristic Mpox rash, which progresses through various stages of sores, blisters, and scabs, is a primary mode of transmission. The virus can also spread through contact with respiratory secretions, such as saliva or mucus, particularly during prolonged face-to-face contact. Intimate contact, including sexual contact, has been identified as a significant driver of transmission in recent outbreaks. This highlights the importance of safe sex practices, including barrier methods like condoms, in reducing the risk of infection. Indirect transmission, while less common, can occur through contact with contaminated materials like clothing, bedding, or towels used by an infected person. It is essential to handle potentially contaminated materials with care and to practice good hygiene, including regular hand washing, to minimize the risk of infection. While the primary mode of transmission is through close contact with an infected individual, it's important to note that Mpox is not considered to be a sexually transmitted infection in the traditional sense. It does not spread through sexual fluids alone and can be transmitted through any form of close contact, regardless of sexual orientation or activity. Recognizing the symptoms of Mpox is crucial for early diagnosis, prompt treatment, and breaking the chain of transmission. The incubation period, or the time between exposure to the virus and the onset of symptoms, typically ranges from 1 to 3 weeks, but can vary from 5 to 21 days. The initial symptoms of Mpox often resemble those of other common viral illnesses, making it challenging to diagnose based on symptoms alone. These early symptoms may include fever, headache, muscle aches, back pain, chills, exhaustion, and swollen lymph nodes. These flu-like symptoms can be mild or severe and may last for several days. The hallmark of Mpox and a key differentiator from other illnesses is the distinctive rash that typically appears 1 to 3 days after the onset of fever. The rash typically begins as flat, red spots that evolve into raised bumps, then fluid-filled blisters, and finally crust over and scab before falling off. The rash can be itchy or painful and can appear anywhere on the body, including the face, palms of the hands, soles of the feet, mouth, genitals, and eyes. It is important to note that the appearance and progression of the rash can vary from person to person. Some individuals may experience a mild rash, while others may have a more severe presentation. If you experience any of these symptoms, especially if you have been in contact with someone who has Mpox or have traveled to an area with known cases, it is essential to seek immediate medical attention for diagnosis and care. Protecting yourself from Mpox involves several key strategies. Firstly, maintaining good hygiene is crucial. Regular hand washing with soap and water can significantly reduce the risk of transmission. Secondly, avoid close contact with individuals who are showing symptoms of Mpox. It's also important to keep your living environment clean and disinfect surfaces regularly. Lastly, staying informed about the latest health advisories and guidelines from reputable health organizations can help you stay ahead in protecting yourself and your loved ones. Currently, there is no specific treatment for Mpox, but supportive care can alleviate symptoms. This includes staying hydrated, taking over-the-counter pain relievers, and getting plenty of rest. Researchers around the world are actively studying Mpox to develop effective treatments and vaccines. Clinical trials are underway, and scientists are hopeful that new therapies will soon be available. It's an ongoing effort, and staying updated on the latest research findings is essential. Certain groups are more vulnerable to Mpox. Individuals with weakened immune systems, such as those undergoing chemotherapy or living with HIV, are at a higher risk. Young children and the elderly are also more susceptible due to their less robust immune systems. Additionally, healthcare workers and caregivers who are in close contact with infected individuals are at an increased risk. It's important for these groups to take extra precautions to protect themselves from infection. The global health response to Mpox has been swift and coordinated. International health organizations are working together to monitor the spread of the virus and provide resources to affected regions. However, it's crucial to ensure that these efforts are equitable. Access to healthcare, vaccines, and treatments should be available to all, regardless of geographic location or economic status. Addressing disparities in healthcare is essential for a truly effective global response to Mpox.